A sudden tightness in your chest. That flicker of fear. Is it just gas? Or something far more serious? Every year, countless older adults ignore these small signals, not because they don't care, but because no one ever told them what to look for. The truth? What you don't know could put you at risk. But what you learn today could save your life, or the life of someone you love. Because not all heart warnings come with pain. Sometimes it's pressure. Sometimes it's shortness of breath. And sometimes, it's just a strange feeling you can't explain. If you've ever felt unsure, confused, or quietly scared, this video is for you. Tap like so more seniors can get this message in time. And subscribe to Better Aging Advice for simple, life-saving tips to stay strong, independent, and in control. You deserve answers. Let's get started. For many seniors, heart problems don't arrive with flashing lights or sudden pain. Instead, they creep in quietly, almost like a whisper you're not sure you heard right. It might start as a mild pressure in your chest, nothing sharp, nothing that steals your breath, just enough to make you pause. Or maybe it's a shortness of breath that comes on when you climb the stairs or take a simple walk outside, something that wasn't there before but doesn't scream emergency. Sometimes, it's a strange fatigue that wraps around you like a heavy blanket, making even your favorite activities feel tiring. The challenge is, these signs aren't loud enough to send you rushing to the doctor right away. They don't feel painful enough to panic over, but they're unsettling enough to make you wonder, is this just part of getting older? Or is my heart trying to tell me something? That question haunts many seniors every day. It's frustrating because the line between normal aging and a warning sign isn't always clear. You might ignore the discomfort, telling yourself it's nothing serious, a little indigestion, stress, or just the aches that come with age. But what if it's not nothing? What if those subtle signs are the body's way of raising a red flag before something worse happens? This confusion is more common than you think. Many older adults hesitate to mention these mild symptoms during doctor visits because they don't want to seem like they're overreacting. They don't want to be labeled as too sensitive or worried. But the truth is, those quiet signals can be lifesavers if recognized early. The good news? You don't have to wait for a crisis to act. Learning to listen carefully to your body and knowing what to do when you notice these subtle signs can help you stay ahead of serious heart problems. In this video, we'll walk through practical techniques to help you understand, manage, and reduce heart discomfort before it becomes an emergency. Because aging doesn't have to mean fear, it can mean being empowered, informed, and in control. You deserve to feel confident in your health, no matter your age. Let me tell you about Marlene, 76, who loved starting her mornings with a walk alongside her loyal dog. It was her favorite quiet time, fresh air, gentle movement, and a moment to herself before the day began. One morning, as she strolled down the familiar path, she suddenly noticed a tightness in her chest. It wasn't sharp or painful, just a slow, creeping pressure that made her pause. She stopped, took a few deep breaths, and after a moment, the feeling faded. The next day, it happened again. That same subtle tightness. Marlene brushed it off, telling herself it was probably gas, or maybe just stress from things going on in her life. She even thought the weather might be playing tricks on her body. It wasn't urgent enough to worry about, just a mild discomfort that passed quickly. But over the next 2 weeks, those episodes kept coming and going. Marlene didn't connect the dots because the symptoms were so faint, so easily dismissed. Then, one afternoon, while picking up groceries, she suddenly fainted and collapsed. At the hospital, doctors explained that Marlene had been experiencing something called silent angina, a type of chest pain or discomfort caused by reduced blood flow to the heart that often goes unnoticed, especially in women and older adults. Unlike typical heart attacks, silent angina can feel subtle or even absent, making it easy to miss the warning signs until things escalate. Greater than I didn't know subtle symptoms could be dangerous, Marlene told me later, her voice still carrying the weight of that scare. I thought I was just tired. I never imagined it could be my heart. Her story is so important because it reminds us that heart warnings don't always shout. Sometimes, they whisper. And those whispers need to be heard before they turn into something life-threatening. If you've ever felt something odd, that strange tightness, unusual fatigue, or unexplained breathlessness, don't ignore it or chalk it up to age or stress. Listen to your body, and talk to your doctor about it. Recognizing these quiet signs early can mean the difference between managing heart health and facing a crisis. Marlene's experience shows that paying attention to even the smallest changes is a powerful way to protect your independence and your life. Because your heart deserves your attention, no matter how subtle the message. Many seniors expect a heart attack to hit like it does in the movies: sudden, crushing chest pain, gasping for breath, and an overwhelming sense of panic. It's dramatic, unmistakable, and demands immediate attention. But the truth is far more complicated, and far more dangerous. For many older adults, heart discomfort doesn't announce itself with loud alarms. Instead, it creeps in quietly, almost like a secret your body is hesitant to share. The symptoms can be subtle: a heavy sensation in the chest that isn't quite pain, a light pressure that feels more like fullness than sharp distress. Sometimes the discomfort doesn't even show up in the chest at all. It might be a tightness in the jaw, a numbness or tingling down the arm, or sudden waves of fatigue and dizziness that leave you weak and unsure. Why is this so confusing? Because as we age, our bodies change in ways that affect how pain is felt and how warning signals are sent. The nerves that carry pain messages may not be as sensitive or responsive as they once were. Blood vessels might already be narrowed or less flexible, reducing blood flow to the heart muscle without triggering the classic, intense pain younger people expect. This means many seniors experience heart problems without the dramatic signs we've all seen in films or heard about on TV. Instead, the danger often builds slowly and silently, with mild symptoms that are easy to dismiss or misinterpret. You might feel unusually tired after simple tasks, or a strange pressure that you chalk up to indigestion or muscle strain. These signs can go unnoticed for days, weeks, or even months. By the time you realize something is wrong, the underlying problem may have been brewing for quite some time, making treatment more urgent and outcomes more uncertain. This is why understanding these subtle signals is critical. It's not just about knowing what heart attacks should look like. It's about recognizing the real, often quiet ways heart trouble shows up in seniors, and acting early before a crisis strikes. That's exactly why this video is so important. Because catching these signs early can give you the chance to take control, get medical help sooner, and reduce your risk of serious complications. And now, with that understanding in place, let's move into the first life-saving technique that every senior needs to know, a simple step you can start today to ease discomfort and protect your heart. Technique 1. Pursed lip rescue breathing. When that uncomfortable tightness or heaviness settles in your chest, one of the most effective and simple techniques you can use immediately is called pursed lip rescue breathing. It's a method widely used in cardiac rehab centers because it helps calm the heart and improves the exchange of oxygen in your lungs, two crucial factors when your heart feels under pressure. Here's how to do it step by step, right where you are. First, breathe in slowly and gently through your nose. Feel the air fill your lungs, but keep it calm and steady, not rushed or deep. Next, purse your lips as if you're about to blow out a candle, or gently blow through a straw. This lip position controls how you release the air. Now, exhale slowly and smoothly through your pursed lips. The key is to make your exhale last about twice as long as your inhale. So, if you breathe in for about 3 seconds, breathe out for 6 seconds. This slow exhale helps relax your chest and your heart. Repeat this pattern continuously for 2 to 3 minutes or until you feel the discomfort ease. Why does this work? Pursed lip breathing naturally activates your parasympathetic nervous system, the part of your nervous system responsible for calming your body down. When you feel heart discomfort or pressure, your sympathetic nervous system, the fight or flight response, often kicks in, making your heart beat faster and your breathing shallow. This only adds to your stress and discomfort. By deliberately slowing your breath and controlling your exhale, pursed lip breathing helps switch your body into a calmer state. It reduces the strain on your heart by lowering your heart rate and easing the work your heart has to do. Plus, it improves the way oxygen moves in and out of your lungs, helping your blood get the oxygen it needs even when your heart is struggling. This simple breathing technique can be done anywhere, at home, out on a walk, or even while sitting in a waiting room. It doesn't require any equipment, and it's safe to do anytime you feel a bit of chest pressure, shortness of breath, or that strange heaviness we talked about earlier. For seniors, mastering pursed lip breathing can be a game changer. It's like having a quick, calming reset button for your heart that you control yourself. If you start practicing this regularly, especially when you first notice discomfort, you can reduce anxiety and support your heart function. Remember, every small step counts when it comes to protecting your health. Try this technique today, give your heart a moment of calm and control when it needs it most. Technique 2, the 3-second clench, vagus nerve activator. One of the most powerful yet often overlooked tools for calming your heart is the vagus nerve. This amazing nerve acts like a natural brake for your heart, helping to slow your heartbeat, lower blood pressure, and ease those scary palpitations or fluttering feelings caused by stress or heart issues. Here's a simple technique to activate your vagus nerve quickly, the 3-second clench. Start by clenching your fists tightly, squeezing every muscle in your hands without causing pain. Hold the clench for a full 3 seconds. Then release your fists completely, letting your hands relax fully. Feel the tension melt away. Repeat this clench and release cycle 5 to 6 times, paying attention to how tension and relaxation flow through your body. For an extra boost, try humming a favorite tune or gently gargling water afterward. Both humming and gargling also stimulate the vagus nerve, sending calming signals to your heart and brain. Why does this work? When you clench your fists, sensory signals travel through your nervous system to the vagus nerve. This nerve then signals your heart to slow, your blood vessels to relax, and your body to calm down. It's like hitting a reset button on your stress response, which often causes racing hearts and discomfort. Many seniors feel palpitations or heart flutters during anxiety or physical stress. These can be frightening, but usually, they're your body reacting to nervous system imbalances. Stimulating your vagus nerve reduces these symptoms naturally and quickly, no medication or special equipment needed. This discreet technique can be done anywhere, at home, running errands, or in a waiting room. It takes less than a minute but can provide real relief and help you feel more in control when your heart feels off rhythm. The vagus nerve is a powerful ally for heart health and stress relief. The 3-second clench gives you a simple way to use that power whenever you need it. Try it today, and notice how your heart calms, your breathing eases, and your worries soften. Small, intentional steps like this can make a big difference in how your heart feels and functions, helping you live confidently every day. Technique 3, left side lying recovery position. When you suddenly feel heart discomfort and aren't sure how serious it is, one simple position can help ease your symptoms, lying on your left side. This isn't just about comfort, it's a strategic move that helps your heart work better and reduces the pressure on some of your body's major blood vessels. Here's why it works: your heart sits slightly to the left side of your chest. When you lie on your left side, you reduce the strain on the heart's left ventricle, the main pumping chamber that sends oxygen-rich blood to your entire body. This position also helps take pressure off the large blood vessels like the vena cava, which returns blood to your heart. Less pressure here means your heart can fill and pump more efficiently. Additionally, lying on your left side helps calm your nervous system's stress response. When you're uncomfortable or scared, your body can go into fight or flight mode, making your heart race and symptoms worse. This resting position signals your body to relax, lowering your heart rate and easing tension. It's important to remember, though, that this is a stabilization technique. If your discomfort continues or worsens, don't delay in seeking emergency medical care. This position buys you a little time and relief, but it's not a replacement for professional help. So, if you ever feel sudden chest tightness or heaviness, try lying down on your left side, keep breathing slowly and calmly, and see if your symptoms ease. It's a simple, practical step you can take while deciding what to do next. Knowing how to support your heart in moments of uncertainty can give you confidence and control, two things that matter a lot when it comes to your health. Technique 4, the magnesium palm test. Magnesium is one of the unsung heroes when it comes to heart health, especially for seniors. It plays a vital role in keeping your heartbeat steady and your blood vessels flexible. But here's the catch: magnesium deficiency is surprisingly common as we age, and it can quietly increase your risk of heart problems without obvious signs. Here's a simple way to check if your magnesium might be running low: the magnesium palm test. Start by holding one hand flat, palm up. Then, without moving your wrist, try to touch your thumb and pinky finger together. If you feel cramping, twitching, or find it difficult to hold that position, it might be a subtle sign that your magnesium levels are low. These muscle spasms or an inability to maintain the pose happen because magnesium helps regulate muscle contractions and nerve signals, including those that control your heart rhythm. What should you do if you notice this? First, focus on adding magnesium-rich foods to your diet. Pumpkin seeds, spinach, and avocado are excellent natural sources. These foods not only support your heart but improve overall muscle and nerve function. Second, talk to your doctor about testing your magnesium levels before starting any supplements. It's important to get the right dose because too much magnesium can also cause issues, especially if you have kidney problems or take certain medications. Why is this so important? Low magnesium can lead to arrhythmias, irregular heartbeats that feel like fluttering or pounding. It can also cause palpitations and stiffening of your blood vessels, which raises your cardiovascular risk. By catching this early with a simple self-test and making smart nutritional choices, you take control of your heart health in a practical and proactive way. Remember, small steps like this can add up to big improvements in how your heart feels and functions every day. Try the magnesium palm test today. It's quick, easy, and could make a real difference. Technique 5, the 5-minute walk rule. When you're out walking and suddenly feel tightness or discomfort in your chest, it can be confusing and scary. How do you know if it's just tired muscles or something more serious, like your heart sending a warning? That's where the 5-minute walk rule comes in, a simple guideline that could help you act fast and stay safe. Here's how it works. The moment you feel chest tightness or any unusual discomfort while walking, stop immediately. Find a safe place to rest and note the exact time you stopped. Now, pay close attention to how your symptoms change during the next few minutes. If the tightness eases or goes away within 5 minutes, this could be a sign of angina, chest pain caused by reduced blood flow to your heart. Angina is a critical early warning that something isn't right, but it's also your chance to get help before things get worse. On the other hand, if the discomfort doesn't improve, or if it gets worse after those 5 minutes, don't hesitate. Seek emergency medical care immediately. This isn't the time to push through or guess what's happening. This simple rule isn't just theory, it has real-life impact. Take Marlene, for example, the 76-year-old who experienced subtle chest tightness on her daily walks. The first time, she ignored it. But the second time, she stopped and rested, using the 5-minute walk rule. When her symptoms persisted beyond 5 minutes, she called for help right away. She told me, "This time, I didn't ignore it. And that's why I'm still here." By using this rule, you give yourself a clear, actionable way to listen to your body without panic or guesswork. It empowers you to recognize when heart discomfort means something serious and when to get help fast. Remember, in heart health, minutes matter. The 5-minute walk rule is a simple tool that could save your life, or the life of someone you love. Keep this technique in mind every time you head out for a walk, and share it with friends and family who might need it too. Your heart deserves that kind of attention. After following the medical advice and practicing these heart-saving techniques every day, Marlene's life began to change in ways she never expected. She told me, "Now I know the signs. I feel in control again." That sense of control wasn't just about managing symptoms, it was about reclaiming her life. Her husband noticed it too. He said, "She walks stronger now. Not just physically, but with confidence." These small, consistent actions did more than ease discomfort, they rebuilt trust in her body and restored peace of mind. If you've ever felt those unexplained chest sensations and wondered what they mean, you're not alone. Maybe it took away your confidence, disrupted your sleep, or stole your peace. I want to hear from you. Share your experience in the comments below. Your story might be the lifeline someone else needs right now. If this video gave you valuable insight or comfort, please tap like. Share it with someone you care about who might benefit from these simple yet powerful techniques. And subscribe to Better Aging Advice for real, practical tools to help you live stronger, longer. Remember, you are not fragile. You are not broken. You are simply waiting to reconnect with the strength that's always been inside you. These techniques are more than just physical exercises, they're lifelines back to your confidence, your independence, and your joy. You've got this. And we've got your back.